The Eastern Cape has achieved a 1 million COVID-19 vaccination registration milestone. The Department of Health in the province says over 700,000 people have already been vaccinated. For more on this, I'm joined now by the General Manager at the Provincial Department, Kidwell Matshotyana, to give us more. Very good morning to you. Thank you for your time. A target of 4.5 million has been set, and you say you're standing at around 1 million rand. Give us then a breakdown of who exactly 1 million, pardon me, not rand, who exactly accounts for this amount of people.
Good morning, Mpho, and good morning to the viewers of Newzroom 405. Basically, for us as the Eastern Cape, this is actually a very exciting milestone, having reached the 1 million mark of vaccination registrations in the province. And this is exciting because of the challenges that we experienced with the issues of registrations, the connectivity in some of the rural areas. But the 1 million mark really is made up of the 60-plus age group, the elderly, at about 504,981, and then also the 50 to 59 age group that makes up 202,906 of that number. What has been exciting, though, is also the increase in the number of the 35 to 49 category that started registering from the 15th of July. The numbers have really been growing exponentially over the past few weeks. At the time of reviewing our report, we had about 812 of that population group. So this is really, we are on the right track to reaching our 4.5 million registrations in the next few months. Thanks, Mpho.
And, we know that civil unrest affected Gauteng and KwaZulu-Natal, dramatically slowing down the number of people that could have been vaccinated throughout the time frames. Now, you say that 1 million have registered to vaccinate, but that doesn't necessarily translate to them vaccinating, even though that they've registered to vaccinate. How will you tackle your way around that situation?
Right. So with the over 1 million that have registered, we have vaccinated about 804,000 at the close of business yesterday. So in terms of the vaccination takeoff, we are vaccinating a lot compared to what we had anticipated initially. The numbers of people that are coming forward to vaccinations are also increasing. What we are doing is that not just the vaccination, but we also allow walk-ins for those people that are unable to register themselves on the different platforms that have been set up for registration. So we are setting up different models to reach people in the communities, even using the partnerships with the private sector to work to visit people in the workplaces for vaccination. So there is an active drive to reach the numbers so that when we talk of the registration, we also look at the numbers that are vaccinated at the same time.
And how are you dealing with some of the myths that are surrounding the vaccination? Not everyone is on par. Although you've seen some great numbers in the Eastern Cape, there are still some concerns around actually going and getting inoculated.
Yeah, no, that remains a concern, and especially at the beginning of the program, there was a lot of myths and misinformation around the vaccination. And at the national level, there's been a lot of efforts by the national department and partners to share correct information and dismiss all the myths about the vaccination. At the provincial level, though, we are working with our communication partners, the local community radios. We're working with the GCIS in the Eastern Cape to make sure that we spread the correct information about vaccination. We're using social media, especially when we're looking at the age category 35 to 49. We are working with our partners to disseminate the information using the various social media platforms. But it's an ongoing activity because there is always the misinformation that is spread around the vaccination program. But we are actively engaging and making sure that the correct information that is released by the department is out there, and it reaches the correct audience as well in their language.
Very well. Thank you so much for that update.